The objective of today's call is to kind of catch up on what's happening, with your offices and what you anticipate happening in the next few weeks, and what precautions you are planning to take in order to have the safest experience for your patients that are returning, and your patients that will need a strong dentist for the future. So I guess I'll just open it up to you. Give us a little bit of background for this crazy times, and what the plans are.
Well, first of all, let me tell you that, as you mentioned, these are trying times, and during these trying times, we want to extend our care and our good wishes to everyone who are listening now, to all our patients, to all our staff members, to all our providers, professionals who work here with us, and for all the general public of the United States, of the whole world, essentially, of the United States and states of New Jersey and New York. Right now, we are located in New Jersey and New York, and our area seems to be hit the worst in this pandemic. As we just listened to the press conferences of our governors, we don't know when we're going to be really open up. And as of now, as per the order of the governors, we are open only for emergencies. So that said, the longer this stay-at-home order remains, the more is the need for urgent procedures and emergency procedures, because right now we are in the second month of this stay-at-home order, and a lot of patients had the dental treatment in process, and some of the patients didn't have the problems, and now they do. And we implement several protocols in terms of how to help them safely. Let's talk about these protocols. Along with the guidelines, we are doing the triage over the phone instead of bringing every patient in like it used to be. Everything changed, and we want to make sure that our patients are healthy, and we are trying to figure out what's going on, and if advice or prescription is necessary, we provide that. And we hope that we can postpone this type of situations until it would be safe for the patients to start with their daily routines. Again, that said, not every patient in dentistry could be helped remotely, and therefore we need to see some patients in the offices, even though we're still under the order. So in terms of the patient's visits, we first of all made sure that everything in the office is extremely safe. As a dentist, we used to have the universal precautions even before the pandemic. We used to have all the PPEs in place. We sterilize and disinfect our areas and our instruments, and all that definitely stays in place. Our autoclaves kill the viruses on the instruments, our pellets and our disinfectants kill the viruses on the surfaces. All that said has been done, is being done. And in terms of patient safety, when the patient comes in, we eliminate our waiting area, quote unquote, in terms of when the patient gets into the parking lot, the patient waiting, calling us, and our receptionist or our office manager will tell them when specifically to come, and that's only after the previous patient left. There is no contact. We greet the patient at the entrance and get the patient right into the treatment room. So there is no waiting in the waiting area. Yes, going forward, we will make sure that when the waiting area is necessary to be used again, when the stay-at-home order being lifted, that will be social distancing. We removed half of the chairs there. We have at least 6 feet apart in terms of the placement of the chairs. However, right now, when we're seeing patients on emergency basis only, there is no waiting area. the patients coming in straight for the treatment and being seated, and we checked what's going on. We're checking the patient, and we figure out what is needed in terms of emergency or urgent care, and we take care of that. We provide the patient with a mask upon the entrance if the patient doesn't have the mask, and the patient comes in, sitting in the chair, getting the treatment done, and leaving the office the same way, basically. In terms of PPE, we have the necessary PPE for these treatments, and we provide for our employees. And we have the insulation lab coats, we have the hats, we have the masks, and we have the shields. So we are protected, and there is no way we can get the virus from one patient to the other, because we take care of ourselves and we take care of our patients this way. We take care of the room and disinfection of the room with the spray and the disinfectant pallets. So everything is clean, everything is either reused or sprayed out. We have all these covers, all these plastics, which we use routinely in between patients. And now we just pay even more attention to that, which we were always paying attention to. And also, we got the air purifier, which is extremely helpful with its so-called not really a natural pressure room, but it provides the venting of the air into the purifier and going through the filters and coming back to the room. And those filters, ultra HEPA filter, specifically made for the purposes of disinfecting the air. Now, what's happening is with these filters, the pore of the filter is smaller than the size of the virus. And therefore, whatever we have, the virus actually doesn't go by itself. It goes in the droplets, if anything. And specifically, those droplets, or the virus itself even, because the pores are so thin and so small, is being deposited there, and the air coming out back into the room is clean. So we proud ourselves to get this type of equipment, and that is done for the safety, obviously, of our patients, our staff, ourselves.